Hi, my name's Jackie Edwards. I'm the consultant nurse in the Manchester Burns Service at Wythenshawe Hospital. I'm going to talk to you today about the use of HydroClean Plus in burn wound management. In burns, the most important element of care is debridement of the deep wounds. This is important not only because it delays healing, but also because of the high risk of infection the deeper the burn is. Surgical intervention is usually the most effective method of wound debridement. However, some patients refuse surgery or admission, while others are completely unfit for surgical intervention due to their comorbidities. Often this means we also can't use sharp debridement, and with fixed necrotic tissue that's thicker and harder to remove, we're really only left with autolytic debridement. This, unfortunately, can take a long time in a burns patient if it's a large area, and often patients will become infected during that process. This encouraged us to have a look at HydroClean Plus as an option for wound debridement. HydroClean Plus is a hydro-responsive wound dressing, and it contains components that cleanse, debride, and absorb, and that helps to remove dead tissue. There is Ringer's solution in the dressing itself, which gives it the moisture and also softens the dead tissue. So this evaluation involved 13 patients treated with HydroClean Plus on 17 deep sloughy wounds. You can see the mean age of the patients was 46 and a half, and they were all small but deep wounds. The patients were treated with HydroClean Plus, usually for 2 to 3 applications until full debridement was achieved. You can see from the charts the dressing was easy to apply and not painful either on application or during the wear time. And because of its silicone strips that are on the dressing, it was easy to remove, and there was virtually no pain on removal. The dressings themselves are limited slightly from a burns perspective in that they are of a certain size. They also, unfortunately, slightly have problems with conformability, but in reality, that is to do with the burn themselves. Burns patients get wounds in a whole variety of places, and they're not just in the standard areas that you would expect a wound to be. The problems with conformability were easily solved by adding extra tape over the dressing. So the patients were happy with this dressing. The dressing change time was 3 days, which normally in burns it's every other day. So they were happy that they were not having their dressings changed as frequently. It wasn't painful at all, and seemed to be very effective at debriding the wounds in a shorter period of time than usual. This is now our standard treatment for any patient who either refuses or cannot undergo surgery. Yes, it takes longer than surgery does, but normally for some of these patients, they can take many months to achieve debridement. So this is a big step forward in terms of what we've had in the past. I do hope you have opportunity to try the product and see for yourself the results that can be achieved.